Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Last week we talked about T5, and of course this week our theme is T6. The vertebrae below, it's T7. So here in the middle at around T6, remember that as you sit, the posture of your body is critical. We've talked in the past about scoliosis, ankylosing spondylitis, and we've talked about text neck. Remember that part where you're sitting with your thumbs? Well, this is all posture that keeps you in a fixed position. In the middle of our back, that section is called the thoracic spine. It's broken down into three sections: the neck or cervical, the thoracic here, and the lumbar down below. So the importance in this mid part that we're talking about today, T6, is to understand that movement and weight bearing are critical. You'll hear us talk a lot about the relationship of discs, tendons, muscles, nerves particularly as well. Remember that between every two vertebrae, we have nerves that go down the spinal cord and pass out between those vertebrae. And you'll have known about the past where there's a numbness down your arm, hand, or fingers, or in the case of your lower back, going down your leg. Well, this simply demonstrates that you know you have nerves to your leg and your arm. Now, when it comes to work, most of our jobs are repetitive. That brings about injury from repetitive strain, if you like. Workplace injuries are a common source of this because most of us have to do something to earn a living. And for many of us, whether it's being seated or the repetitive nature of our work, that's going to cause an overuse at times. That overuse can be characterized from just prolonged sitting still or from doing a task that's just back and forth, back and forth. This is where you have to learn to get out of that posture, particularly in the sitting environment. Get your hands off the keyboard, get out of the chair, and just move and stand around for 2 minutes and then sit again. Repetitive strain starts to cause problems for the tendons and the muscles. It's really important to do exercise. These exercises are critical in the workplace and at home, but particularly in the workplace where repetitive strain due to prolonged sitting still or the repetitive use of one part of your body is going to cause a problem. In our work habits, it's really important to learn that ergonomics is critical, but don't depend on ergonomics and the job to always blend itself around you. You still have to adapt to the work task. Remember, your back is important to your daily health. Join me on the next show as we continue our journey down your spine.